that done before.
And as you can see, everything you need is there. I'm going to take my sterile drape. As I said, I will have 2 of these.
That whole thing done. She put regular gloves on in the box.
Did he have inline suctioning? If they
I
had
put this on my table.
Patients back in to do that.
All of my sterile equipment is there. I have 3 separate bins here. 1, 2, 3. I'm going to pour peroxide in one. I'm going to pour a weak solution of peroxide and saline in one. And then the other one is just sterile saline.
Gary, in Egan's it says that you can use sterile water and peroxide also. Is that
You can use
acceptable?
water.
Okay.
You can use water or saline, whichever. Now to put on my sterile gloves. Notice I'm just touching the cups. This part is still clean because I have not touched anything on there yet. I have all of my equipment laid out. Remember the old sterile, put your gloves on sterile routine? That everybody hated? You're going to hate it again. Remember I told you it would come back to bite you in the butt? And just like before, you're going to decide which is your clean hand and which is your dirty hand. This is my clean hand because it's my dominant hand. This is my dirty hand. So now I can separate all of my equipment. And one thing I forgot to do before I put my gloves on, that was open my trach tie. Is there a trach tie over there?
I stopped.
Yeah. And I should have done that before I put my sterile gloves on. Okay. Now I can remove this. Holding this. I'm going to remove my gauze. Throw that in the garbage. I can now use this to clean. Now this is a old pipe cleaner. When you're cleaning with this end, if you touch it, that's sticky. You're not going to use that on the patient. You're going to fold it.
When you took the dressing out, you did it with you removed the dressing with your
Dirty hand.
but you can't use your clean hand to stabilize the trach, can you? No.
If you can do this, you see what I'm doing? I'm holding here and I'm pulling here. You learn to do a lot of things with one hand.
Interesting.
My weak solution.
Not done with
I'm going to clean around and toss. Use once and toss.
You don't dip it in anything?
She dips it in the weak solution.
The weak
Oh,
solution.
I missed that part, sorry.
Clean under. You also can clean inside all of these little things here. Make sure you reoxygenate your patient between. If I need to remove this now, that's dirty. Reoxygenate. And now I can get another one of these, or I can get the little, what do you call these things? Okay.
I thought you weren't supposed to let go of the trach. How?
I still have it tied. I
Oh,
haven't
okay, only
taken
when
it
it's
loose
not
yet.
tied. Okay.
And toss. Now, if I were using a non-disposable inner cannula, that would now be soaking in my peroxide solution. This guy has disposable, so I don't have to do that. So, if you had this kind that was non-disposable, when you took it out, you would put it in your peroxide, and it would be soaking all this time.
You didn't go inside the hole with the Q-tip. You just
Not
went around
inside, just around the outside, like in here. You really get a lot of crusty mucus on this side, and then these little grooves right here. So you really want to clean that out. So you know, you're not going to stick it down the hole.
No.
No.
But not in at all.
And you're cleaning with your clean hand, right? Okay.
In the weak solution.
In the weak solution. Now, if this were in here, and if this were my if I was going to have to put that back in, now I could use my brush and scrub it out.
So the only thing the full peroxide is for is cleaning
To soak the dirt,
non-disposable
right.
cannula.
That's the only thing the peroxide
So you
is
don't
for.
need to pour that if you know it's disposable.
If you know it's a disposable one, you don't even need the peroxide. You need the weak solution of peroxide in water because you still need to cleanse around all of this dirty stuff
Right,
here.
okay.
If you were going to do that, then you would rinse it out
Mary,
and reinsert it. Yeah,
another backup question.
okay.
You said before, oh, I should have done that before I got sterile.
Open this.
About the ties. But the ties are still on.
These are the dirty ties. I haven't changed them yet.
Okay. So what ties were you referring to before?
This, the clean one. Because now that I've cleaned everything, now I'm going to put a new tie on this guy. But that's not a sterile procedure.
Okay, so you could change and just put regular gloves on to
Exactly.
do that at the end.
Exactly.
Okay, that's all.
I have cleaned around the outside. I have cleaned the inside. I have put my clean inner cannula back in. Now I can take these off because I no longer need these. I can put on regular gloves.
Or you could just keep them on.
Or I could just keep, yeah, because they're contaminated, so it doesn't matter. It doesn't matter if I contaminate them now. I've already done the cleaning part. Right. But notice I've never taken him off the oxygen. And you guys have done this. Now is the part where we're going to put the clean tie on. When I open it, I like to make sure that I have the sticky part because I never remember which one's the sticky side. That's the sticky side. With him still on his oxygen, okay? Now I'm going to hold on to this thing and never let go. I can either move it to the side or I can pull it down, but I'm going to hold on to this thing and not let it go while I have this off. Disconnect. And please don't do what I see some students do and cover this, because then your patient can't breathe at all. I'm holding it here. This is going under there. Is this the sticky side? Nope, I have it the wrong way.
Done once every 8 hours?
Trach Care should be done once every 8 hours, yes.
Doesn't your clean hand when you're cleaning around the tree get dirty though, or no?
The more you do it, the more contamination you get on your hand, yes.
Because you clean it before you replace it, right? So then, but you're holding the clean end of the pipe cleaner, so it's not
Yeah.
really getting dirty.
You're holding the clean end, and hopefully you're not touching anything that's got gunk or so in it with your clean
So
hand.
your hand still stays clean, so
Right.
then you're able to replace it. But what happens if you get it on, you have to
Put on another pair of sterile
Okay.
gloves. Now this one goes on the other side. Now this is the part where, remember, you were saying I let go of it. This is where you don't let go of it ever. And I'm right-handed, so I gotta. Now this can come around. Make sure it's snug but not tight. Now this can go around here. Now I have a little excess piece here that I would cut off. I would want to be able to get one finger underneath there. I don't want it so tight that it's cutting off the circulation. Remember, you have your carotid artery and a few veins in it here, so you don't want it that tight. You want it snug enough that if he were to cough or something, it's out, but you don't want it so tight you're cutting off his circulation, so you really want to get a finger underneath, be able to get a finger underneath there. Oh, we can't both put our fingers under there.
Then you just cut that.
Hmm?
Then just
I would
cut-
just cut that off.
So Mary, that like short period of time that you didn't have him getting the
Is there
oxygen,
scissors
the patient
anywhere?
would be okay, right? Like, they'd be stable enough for you to be able to make.
Well, that's
the
why I'm
change
giving them
after.
100%. What I'm doing is, in case I do have to have it off for a couple of seconds,
Then
I'm not
he'd be okay.
compromising him that much.
Okay.
Okay, now that I've got that back on, I can put my piece of gauze under. Now, some therapists like to put the gauze under before they put the ties on. Some put it on after. If whichever way you do it, I'm not gonna, as long as you get it done.
And everything stays the same whether they're on a ventilator or what you just did,
What do you mean everything stays the
as
same?
far as the clean, how you
Yeah.
use cleaning? And
Yeah, everything else stays the
You
same.
just connect them as quick as you could to clean the cannula area. Because you took the Q-tip and you went around the whole perimeter.
Well, he was on a trach collar. Not on the, but if he were on
That's what I'm saying.
Are you gonna go over it with
yeah, if he were on the ventilator, you would still try to do that, but you just make sure you do it quickly so you can make, before you put that, the new inner cannula back in.
I have a big one right there.
Make sure you keep this out of the way.
Put that gauze on before the collar also?
Like I said, some therapists put it on before, some therapists put it on after. I'm not gonna hold you, you know, as long as you get it on correctly without compromising the patient.
I guess it might make sense to change it afterwards, because it's gonna, what's there is gonna soak up all the gunk that you get free with the pipe cleaner. And
Say
the
that
gunk.
again?
If you change it afterwards, after you're done